Good evening, families. Thank you for joining us for this town hall where we want to give you an update about our school opening. I'm Patty Salzman, Deputy Superintendent, and I'm here with Tony Thompson, our Associate Superintendent, and our plan is to give you an update in 3 categories. The first thing we would like to talk about is safety protocols. The second, we will have an opportunity to interact with an expert so that we can address some questions that many of you have had in regards to COVID safety. And the third thing is we would like to give you some academic updates because we know you're very interested in how we're going to approach this year, given that we are going to be back in person. If you could put the slides up. So the first section we're going to cover is on safety protocols. Many of you have had questions about whether we're going to be offering remote learning. So we wanted to share with you that the 87th legislature this summer did not approve provisions to fund remote learning for the 2021-2022 school year. They didn't approve it for any school district in Texas. What that means for us is that we plan on welcoming back all of our students in person on August the 9th. Now, we realize that there are some students who have medical conditions that make attending school dangerous for them. So we do have a system for parents to request homebound services for students who have medically documented conditions. And towards the end of the presentation, I'll share with you how you can access that information and where you can submit a request to have homebound services for your child. In terms of safety protocols, our decision is to continue with the safety protocols that we implemented, that we used predominantly throughout the whole year to mitigate COVID. And to include all of the up-to-date guidance that we've received from the Centers for Disease Control and Prevention, from our local Metropolitan Health District, and of course also from the Texas Education Agency. So we will continue with hand washing. We will also continue to encourage our students to wear masks, but we will have an opt-out provision, and I'll talk to you about that in just a second. We will also continue sanitizing. As you recall, last year, we installed sanitizers in every classroom and also provided specialized equipment for sanitizing. We will continue to do that because sharing water fountains can be a place where students can get sick and expose each other. We will not activate our water fountains. We will continue to use them as water filling stations. So we encourage families to send children to school with water bottles where they can have fresh water. We will also continue to use plexiglass dividers and partitions, and we will use air filtration. We will also continue to socially distance to the maximum extent possible, and we will get an update shortly about what that distance will be. So in terms of the mask wearing, I mentioned that we have an opt-out provision. So we are going to be continuing to encourage students to wear masks because we have heard overwhelmingly from our families that they do want their children to wear masks, and they are counting on the school and their teachers to help them, to help remind children, especially the young children who are not eligible for vaccinations. But we also realize there may be parents that do not want their children to wear masks. And so we're asking that you complete an opt-out so we'll know not to remind your child. Again, the children will not get in trouble. We will not mandate children to wear a mask. It is simply a way for us to honor parent requests and family requests around helping to keep their children safe. The next section is an expert Q&A, and for this, I am going to turn over the presentation to Tony Thompson, our Associate Superintendent.
Thank you. And good afternoon, good evening. We're pleased to spend some time with you as your children prepare to return to school in a little bit over a week. One of the things that I want to mention before I introduce our guest speaker is the importance of testing and vaccinations. And we're going to have a lot of information that we'll share with you, about both testing and vaccinations. It's not advancing. Okay, well, okay. We'll come back to that. I think we're going to go on and move to our expert. We're privileged to have Dr. Erica Gonzalez, who's the CEO and president of STAMP, South Texas Allergy and Asthma Medical Professionals. Dr. Gonzalez specializes in allergy and immunology, has worked in pediatrics, and she's attended a couple of town hall meetings with us in the past because she brings so much expertise, to the school district and certainly to you as families that will help you understand the importance of vaccinations, but the importance of other topics and issues related to COVID-19 and the Delta variant. So first of all, Dr. Gonzalez, thank you for sharing your time with us again today. We always look forward to hearing from an expert, and we appreciate your time. Also a graduate of Burbank High School and is certainly happy to kind of give back and share information with our family and communities. So Dr. Gonzalez, we have the questions that have been prepared in preparation for this, but I'd like for you to start, if we can just let Dr. Gonzalez start by just kind of opening up and talking about some of the history and the science and the research associated with the 3 vaccines that are currently being offered right now.
Absolutely. Thank you so much, Tony. It's good to be here this afternoon to be able to help answer any questions that our families in the school district may have. When you look at the research that has been done on the vaccines, early on, many people were concerned at how fast we were able to get authorization for these vaccines. One thing to note is that although the timeline was quicker, there was no steps that were skipped. It still had to go through all the same processes and had to pass all the same tests that any other medication or vaccine would have to. It's just that in this scenario, we had scientists that were working around the world being able to get to the numbers that would give us validated results in a much faster fashion. And so with that, we know that the protocols were safe and proved that the vaccines were both safe and effective against the different viruses. The initial ones that came out on the market, as we know, was Pfizer, followed 2 weeks later by Moderna, and then the J&J about a month later in January of 2020. Moderna and Pfizer were tested only against the original strain and showed that it had about a 99% protection rate against the original strain. And the J&J, when it came out, it had already been tested against some of the variants and was found to be about 67 to 70% effective. That is the same efficacy that the Pfizer and the Moderna vaccine will have also to the variants. So that's where those differences in numbers comes from. But when you put them all together and try to compare them, apples to apples, then they all have the same type of efficacy to the variants that we are now seeing in the community. But just want to reassure everyone that there was no shortcuts taken and that the studies were done in a safe fashion and according to all of the FDA guidelines to make sure that they were putting products out in the market that were going to be safe for the community.
Thank you. If we go to the questions that we've compiled thus far, I'll just ask you to respond to these as we kind of go through them. The first is, how are the positivity rates in Bexar County trending right now, and how do higher positive rates affect prevention strategies that should be used?
So what we're seeing in Bexar County right now is similar to what other cities are seeing across the U.S. In a month time frame, we have seen our positivity rates go from 3% to approximately 20% of the population that are being tested. So that is extremely high, especially in such a short span of time. The majority of the positive testing that we are seeing is being secondary or due to the Delta variant. And when we start to see this happen, we once again have to try to implement restrictions that will help prevent the spread of the virus, which means that you'll probably see more businesses, kind of recommend or highly recommend the wearing of face masks indoors and outdoors, maintaining the 6 feet distance and making sure that you're washing your hands frequently and use antiseptic. So whereas we had been able to step back a little bit from that because the rates of transmission had decreased, we're once again in a situation where we're seeing the virus rapidly be transmitted. And so we need to, again, begin to take those precautions that we were taking in the beginning.
Okay. Why are some of the, or what are some of the key preventative strategies or safety guidelines that must be followed for vaccinated and unvaccinated individuals?
So the preventative strategies in general are the same in the sense that we should be trying to promote the use of masks, especially when we are indoors and especially when we're in situations where there may be large crowds gathering. Whenever possible, we should try to maintain a 6 foot distance and as previously stated, just frequent hand washing and the use of antiseptic. The only difference in a vaccinated and unvaccinated person is the vaccinated individual will be less likely to be infected with the virus if they don't happen to be as stringent with these preventative strategies. But even vaccinated individuals, in order to help stop the spread or decrease the spread, should be encouraged to use masks, mainly to help protect others in our community.
How long should exposed individuals quarantine, vaccinated versus unvaccinated?
So if you are vaccinated and you have been exposed to someone who is positive to COVID, the recommendation is to take a test 3 to 5 days after the exposure. And if it's negative at that point, you can come out, no problem. It's safe to assume that you were not infected. If you're unvaccinated, then we still have to do that 10-day waiting period, knowing that the risk of transmission is higher in an unvaccinated individual. So even if their test came back negative early on, the CDC is still going to recommend a 10-day quarantine period minimum for those for the possibility that the test just did not pick up the infection at that point. So you have a little bit of more flexibility if you're vaccinated to be able to, get a test and say, okay, everything's good. I'm able to not have to quarantine and can come out of isolation.
Is there a projected time frame for the vaccines to be on the market for the 5 to 11-year-old population?
Yes, there is. So, both Pfizer and Moderna are currently doing the research studies in pediatrics. Pfizer has been the one who has been at the lead of this, so they're kind of leading the way. As we know, we got the indication for 12 and up a couple of months ago. The studies for the 5 to 11-year-olds are currently being wrapped up as we speak. And so we anticipate that by late August, early September, we should be getting the indication for that age group to be able to get vaccinated as well. And at the same time, right now, Pfizer has started the studies on 2 months to 5-year-olds. So they've already started that age group as well. And Moderna is still working on the 12 to 17 age groups. So the first opportunity is going to look to be September for our 5 to 11-year-olds.
Okay, good. When might the current vaccines receive final FDA approval, since they are still approved for emergency authorization use only?
That's a very good question. The Obviously, we know that all of the vaccine have the EUA approval, which means that it's approved because of an emergency use. As long as we're still in a pandemic situation, then the EUA will be applicable. I am not sure if they are concurrently working on getting official FDA approval outside of the EUA. I would imagine that they are, but that is not something that has been largely talked about or published, so I don't know the answer to that. I just know that as long as we're still in a pandemic situation, then the EUA, the emergency authorized use, will be in place and will be applicable.
Okay.
Here, give me that remote.
Okay. Just a second. Want to go back to the other questions.
Could you
One
put the
of them.
slide deck back up, please?
It's missing. Yep, that's it. What are the primary differences, Dr. Gonzalez, that individuals who are not vaccinated experience or should anticipate as opposed to those who are fully vaccinated?
The biggest difference is going to be that if you are vaccinated, you are going to be less likely to be infected with the virus, even if you're exposed to it, versus somebody who is unvaccinated, who will most likely get the virus if they're exposed to it, especially with the Delta variant. We have found the Delta variant to be extremely contagious. Thankfully, it has not proven to be more fatal or than the other variants, which is good. But the negative to the Delta variant is that it's easily transmissible. So somebody who's vaccinated is going to be less likely to get it. And in the chance that they do get it, the symptoms are going to be much less severe, and they're less likely to have complications or require hospitalizations from the virus itself. And the majority of the deaths that we are seeing right now, 99% of them in the Delta variant, are being seen in the unvaccinated individual. So you're just much more protected, and your body is better equipped to fight the virus if you have received the vaccine.
This next question is really kind of an extension of the one you just answered, but why are vaccinated individuals continuing to test positive?
So there is no vaccine that is 100% protective. So we do know that even if you are vaccinated, that doesn't mean that you are completely immune to being infected. It just means that you're less likely. But more importantly is the fact that if you do happen to get it, that the virus is going to be less potent. It's not going to cause as many problems, and you're going to be able to fight off the virus much better than if you were unvaccinated. And that really is the advantage there.
And this question is also a bit of an extension, but you know, what are some of the, I guess, privileges that the vaccinated have that are not necessarily available for the unvaccinated population?
So some of the things that we're seeing in travel, if you are vaccinated, and right now they actually haven't started to ask for proof of vaccination, but we will get to a point where they will be asking for proof of vaccination. But if you are traveling and you have been vaccinated, a quarantine period when you get to the new location is not going to be needed. Travel is going to be more open to those that are vaccinated. In addition, if you happen to be vaccinated and exposed to somebody who is positive, but you're not experiencing any symptoms, then you don't have to follow the testing protocols where somebody who's unvaccinated, if they're exposed, even if they're asymptomatic, would have to test. And this was what we were seeing a lot of times when, you know, you were trying to get the clearance to either go back to school or go back to work. Vaccinated individuals are going to have a lot more leeway in not needing to be tested because of the higher protection rate that they have.
Why are vaccinated individuals still being recommended that they wear masks? And I know that new CDC guidance has come out in the last few days about this topic, but why is that important?
The reason it's important is because what masks do are to help decrease the rate of transmission. So a person who's vaccinated is going to be well protected. They're not wearing the mask to protect themselves. They're wearing the mask because even though they are vaccinated, we can't say 100% that they're not infected. And so as long as they're wearing a mask, they're helping to decrease the rate of transmission of the virus itself, which is why in the very beginning of this whole pandemic, we encouraged people to wear masks to, help others and not necessarily protect yourself. It's a way to help reduce the transmission in the community. And that is why the CDC guidelines have recently changed, because the trends in all of the cities here in the US, we're seeing them go up at very alarming rates. And so it's time to start thinking again about all of us trying to do our part by wearing masks in order to help reduce transmission, because we could be carriers and not even know it.
And are there key differences between the COVID-19 and the Delta variant that are important to know about?
So there's very small differences, and I do want to point out that the fact that the virus is mutating is not something that was unexpected. We see this with all types of viruses, and the most common one would be the flu. And so we know that viruses, as they replicate, will go through mutations. And so it's not something that is different in the COVID strain than any other viral strain. We have seen that the biggest difference from the original strain and even some of the other variants that came out afterwards to the Delta strain is that for some reason it changed and mutated enough to where it is very easily transmissible. And so we're not sure why you are able to transmit it at a much faster rate. And so that's really the key difference. But I also do want to emphasize that luckily it has not proven to be more fatal. And that's where, I want to reassure the community that although it is spreading at a much faster rate than the original strain, luckily we're seeing the same trends as far as complications and death rates than when we compared it to the original strain itself.
Very good. How long does the vaccine provide protection, or when do you anticipate a booster would be needed?
So early on, we anticipated that a booster would be needed every year, similar to the flu vaccine. When the original studies on the vaccines were done, they were started in, they were started in about June, July of 2020. And we had our first authorized use in the middle of December. And so those patients that got vaccinated in those trials last June and July are the ones that are being followed up to now, which would be the 1-year mark, to see where their antibody titers are. Based on the information that we're seeing, it looks like a booster is going to be recommended for those at high risk, which would be those over the age of 65 or anybody who may be immunocompromised. Pfizer is recommending a booster at about 6 months after the second dose of the vaccine. And if you're not in a high-risk category, it looks like it's going to be closer to 12 months, so yearly, like the flu vaccine. There has been no consensus as to when a booster should be recommended. This is something that Pfizer continues to speak to the FDA and the CDC about, and we anticipate that in the next couple of weeks, they will come to a consensus to state when booster vaccines will be needed. But in my opinion, you'll definitely need one on a yearly basis.
How do, for families who have not been vaccinated yet, they certainly may have questions about how you manage the side effects from the vaccine and what the most common side effects are, particularly for children.
Sure, and this, of course, is a very big concern for most parents. Most common side effects are going to be tenderness, soreness, redness at the site of the injection. And that's what we see with, anytime we inject anything. So that's going to be the most common symptoms, that they have soreness in the area, arm pain, and a little bit of redness. There's also the possibility to have cold-like symptoms, fevers, body aches, chills, headaches. These are normally mild symptoms and can be well controlled with the use of ibuprofen or Tylenol products. And most people, if they take those, can manage any of the symptoms that they are experiencing very well and keep themselves comfortable. Fortunately, most of these symptoms only occur within the first 24 hours. And so most patients, even if they get side effects, tend to not have them last longer than 24 to 36 hours and tend to be able to control them well with the use of Motrin or Tylenol.
We have a few other questions that weren't included on the slides, and I'm going to ask those now. One is kind of an extension of the side effect question. And how do parents know if their child is suffering from allergies or something that might be more commonplace as opposed to having COVID-like symptoms or potentially being positive for COVID?
Sure. So, this was a question that, many people had in the beginning too, especially here in San Antonio when so many of us suffer from allergies. With COVID, the symptoms are going to tend to be a little bit more severe. So although you will see, the same nasal congestion, runny nose, if you have a fever, you should be thinking more of a viral illness. It could be COVID, it could be something else. But with allergies, you'll get the sneezing, you'll get the congestion, you'll get the runny nose. But allergies in general do not cause fevers to spike. So if you're looking at a temperature above 100.5, then at that point you should be thinking that it's more of a viral etiology than an allergy. Also, another simple thing to do is to give an over-the-counter antihistamine. And if it is allergies, you'll see those symptoms get better. Even if they don't completely resolve, they will get better. If you're taking an over-the-counter antihistamine and the symptoms are not improving at all, that would be another kind of maybe clue to, hey, maybe we're looking at a virus here that could possibly be COVID.
Under those circumstances, do you recommend, testing for students and for families? Certainly we offer testing during the year, but do you highly recommend that parents go out and get their children tested?
So I'm going to answer that question two ways. So yes, the recommendation would be for them to get tested, especially right now when we know the virus is being transmitted so quickly. And the reason for that is so that they know we need to stay home, we need to quarantine until the infection is over so we don't go out and spread the virus. If you are committed to staying home anyway, then there's no advantage in getting tested, but the commitment has to be there that it's like, look, I'm not going to go get tested because I don't want my child to have to go through the nasal swab, but I'm going to commit that for the next 10 days, we're going to isolate in the home so that in case they are positive, they're not going out and spreading it. So really it's more important to test so we know whether we need to stay indoors and not spread it, or if we're able to kind of go out and not have to isolate ourselves.
Can you describe the timeline that it takes to become fully vaccinated, depending on which vaccine you're getting?
So when we're looking at Pfizer and Moderna, that's a 2-dose vaccine schedule. And so you get your first dose, and within 2 weeks of the first dose, you're about 60% protected. Within 21 to 28 days, depending on which vaccine you did, 21 days if it's Pfizer, 28 days if it's Moderna, you get the second dose. And within 2 weeks of that, you would be at the 99% protection rate that was originally described in the research studies. So you're looking at about 6 weeks after the first dose to see somebody be fully vaccinated and protected to the level that is described in the research. For Johnson & Johnson, they did their doses just a 1 dose. So 2 weeks after the Johnson & Johnson, you'll have a 67% protected level. So 2 weeks after the first dose for Johnson & Johnson, because it's just a 1-dose series, and 2 weeks after the second dose for Moderna and vaccine, because they are a 2-dose scheduled.
Dr. Gonzalez, if individuals lose their vaccine cards, what's the best way for them to go about getting another one?
So luckily, the state, and I think it's not just Texas, but all the other states have great registries where if you get a vaccine, you are entered into the registry. So as a physician who is authorized to give COVID vaccine, because you do have to get authorization to be able to give COVID vaccine, I'm able to look up anybody who has gotten the vaccine. So if any provider is eligible to give the vaccine, you should be able to go to them and say, hey, I lost my card. Would you mind looking me up in the system and writing me out a new card? And they can verify in the system where you got the shot, when you got the shot, what dose and what lot number it came from, and they're able to recreate the vaccine card for you.
That's good to know. That's real good to know. Earlier, you addressed something about a 3 to 5 day period before testing. And I think you were saying that in response to the question about being exposed and potentially a close contact. So does the 3 to 5 day period before you go and get tested apply to just vaccinated individuals or also to unvaccinated?
It applies to both, Tony. The difference is that what you do with the results at that time is going to differ between the vaccinated and the unvaccinated. So if it's negative and you've been vaccinated, you're cleared. You get the green light to continue to go on, and you're safely assume that you don't have COVID. When you haven't been vaccinated, then you don't really get the green light. You kind of get the yellow light. You're told, well, you most likely don't have it, but we can't be sure. So you still have to wait another 6 days to make sure that you don't happen to develop symptoms at that point. And so that's the key difference, is what do we do afterwards with the results? If you're vaccinated, we're going to say you can go out, you're good. If you're unvaccinated, it's going to be a little bit trickier, and we're going to probably still recommend that you quarantine.
Can you speak about household members? You know, if you have a household member who tested positive and maybe you're vaccinated, maybe somebody else in the household is not vaccinated, what does that potentially mean for them in terms of quarantining and isolating, depending on their circumstance?
So that is another thing that the CDC has just recently talked about in relation to wearing of masks. So if you have someone in the household who is high risk or who is not vaccinated, then as an individual who is vaccinated, it is still important to wear your mask to try to help keep them protected. And this would apply both to a vaccinated and an unvaccinated individual. If you have high-risk people in your household and you know that you've been out and about and could have been possibly exposed, you really want to stay away, especially right now with the Delta variant, because of how easy it's being transmitted. We are seeing people come in where it is not uncommon that 100% of the household is infected. Whereas before we used to see maybe 1 or 2 individuals have been infected and maybe a couple of family members that had not been infected yet. That is not what we're seeing anymore. We're seeing 100% of the households being infected, which just goes in line with how easily the Delta variant is transmitted. So if you have a mixture of vaccinated and unvaccinated people in your household, you still want to do your best to try to protect those that are not vaccinated, and wear your mask and practice some of the social distancing so that you can help prevent the transmission to them, where it would be worse outcomes if they did get infected.
So in that scenario, should the vaccinated person in that household continue to quarantine, or should they wait until they test in 3 to 5 days? Or if they're not experiencing any symptoms, are they okay to move about?
Okay, yes, and I'm sorry, when you asked me the question, I understood it as a generality, like it's, you know, in a household where you have vaccinated and unvaccinated. But if you are vaccinated and you test negative, then you're not assumed to be contagious. So in that regard, you would just take the same precautions that you would normally take to try to protect any other household member who may be at risk because of either a chronic condition or because they themselves have not been vaccinated.
Okay, thank you. We have some other questions that I'm going to go on and address now, but I'd like for you to continue to be on standby for a little bit, Dr. Gonzalez, in case there are more that would require your expertise. Some of these are going to be more operational, kinds of questions. One is whether or not SAISD is going to offer testing on site at schools. That's certainly our hope. We provided that this past year, for all campuses and departments. We're waiting for TEA to provide official approval and funding for different providers that we're working with, but that's certainly our hope. And we certainly encourage students and staff members to sign up for weekly testing. We had a great partnership this year, and we hope to continue that. And we should have some information in a couple of weeks. Will all SAISD staff be required to be vaccinated before the start of the school year? Currently, we're not able to require vaccinations. We're highly encouraging that all employees get vaccinated and that students who are eligible get vaccinated as well. There may be some who have medical conditions that would prevent them from getting vaccinated, and that's certainly easy to, capture in medical documentation. And the other exception would be for religious reasons. But we're strongly encouraging, but we're not actually able to require that at this time. Will unmasked students be separated from masked students? No, we just have to be more thoughtful and mindful of, who the unmasked students are, especially if there's some exposure, so that we'll know how to kind of handle, their situations if they become exposed to positive individuals. Will parents still be notified when there are COVID cases at schools? Yes, absolutely. Campuses will continue to send out notifications, hopefully within 48 hours of identifying the lab confirmed case. Sometimes it's sooner, but we'll continue to communicate not only with parents, but also with staff members on campuses when that happens. Can I find out if my teacher's child is vaccinated? That's really protected information. Teachers or other staff members can willingly disclose that information and share that, but it's not something that we would provide. It would be something that the employee would have to be willing to share at this point. And I keep saying at this point because things change, over time, but currently those are the guidelines that we're operating under. Are teachers going to be masking, or can they opt out? We're not going to require an opt-out. We're going to, again, continue to encourage everyone indoors, in buildings, particularly during this spike that we're experiencing right now, to remain masked. If they're within, for adults, it's going to be if they're within 6 feet of someone else, because that's just the best practice and recommendation coming from CDC and from Metro Health. Let's see, required to be vaccinated. I think those are all of the additional questions. Contact tracing procedure, great question. We continue to contact trace in a way that is similar to what we did last year. So once we know that there's a lab confirmed case that's been identified, we speak to, if it involves a student, we speak with the staff members who support or supervise the students. So whether it's the regular teacher, if there's an instructional assistant that supports that classroom, if there's a speech language pathologist that supports the student, we will have a nurse, an LVN or an RN, communicate directly, with the teachers and other staff members that support the student to ask a series of questions that will help us identify anyone who may be considered a high-risk exposure. If it's a student-to-student case, the high-risk exposure would be determined if they were within 3 feet of each other, 3 to 6 feet of each other, and both parties were not consistently or correctly masked. With students, if it is a student-to-student case and they're both correctly and consistently masked and within 3 to 6 feet of each other, then they would not be considered a high-risk exposure if they're unvaccinated, and they would not have to quarantine. When we have fully vaccinated individuals, then they're not going to be considered close contacts who'd have to quarantine as long as they're asymptomatic, not experiencing any symptoms. If a student is exposed to an adult who's positive, or if an adult is exposed to a student who's positive, then we're not looking at the 3 feet physical distancing. We're looking at 6 feet physical distancing to determine if they're close contacts, if they're not fully vaccinated. Again, if they're fully vaccinated, then we don't have the same concerns, and we don't have to quarantine the individuals as long as they're not experiencing any symptoms. Any more questions, Ms. Salzman?
No.
No. So I think we have perhaps one more.
One more.
And then I'm going to turn it back to you, Dr. Gonzalez, to see if you have anything else that you'd like to share.
Yep. Yeah, there's one here. I'll address this one right here.
Okay, we had a question from a parent, and again, thank you for being part of this today, who was sent home due to being exposed at school. She's been asked to quarantine. Will she be counted till the 12th or allowed makeup work? So we're going to answer that in 2 parts. The first part is, if your child has already been exposed and sent home to quarantine, we're going to follow the 10-day period, the 10-day timeline. And 10 days will end before August 9th. So your child should be able to return to school. Now, this is a new interpretation from CDC through Metro Health. So your campus may have said that your child would have to be out for 14 days, but we're changing that to 10 days. As long as your child doesn't have any symptoms at the end of that period, fever-free without using fever-reducing medications for 24 hours. So your child should be able to return to school on the first day of school. And we're going to have Student Health Services follow up to make sure that anyone who was quarantined during this period is able to communicate and convey to parents, you know, when their children are able to come back. And the good news is anybody that's quarantined through tomorrow would be hopefully good to go when it's time to return to school on August 9th. When letters go home to parents, how can parents use that as a tool to protect their child? Not real sure that I completely understand that question in terms of using it as a tool to protect the child. You know, if a parent, let me share one scenario. We've had parents come to us and ask for something that makes clear that their child has to quarantine, because they need that for employment purposes. They need that to take to their employer. So that will provide when it's requested, but I'm just not sure that I completely understand the implications for protecting your child, other than the fact that, as I think through this, you may be asking, what do I need to do to make sure that my child stays safe? And if that's the question, the answer is continue to monitor your child. Monitor closely to see if your child is developing any symptoms or manifesting any symptoms that are not typical, such as the ones that Dr. Gonzalez described. If your child typically has allergy symptoms, it's probably okay. But when the child spikes a fever, then, you know, that's something different. So continue to monitor closely, and certainly reach out to, you know, your healthcare provider if you experience anything that you're concerned about. But Dr. Gonzalez, I'm going to ask you to elaborate on that, because I think that's probably the question that the parent has. If my child was exposed, my child is a close contact, has to quarantine, what do I need to do to make sure that I'm looking after my child and making sure that my child is going to be okay?
So this would go back to, you know, if your child has been exposed and they have not yet had symptoms, then anywhere from 3 to 5 days after the exposure, you can go get a test. And if it's negative, you can assume that the child has not gotten the virus if they've already been vaccinated. During that time, you just do what you would normally do as far as supportive care. If they do happen to become symptomatic, then, you know, just treat based on the symptoms to keep them comfortable. There's nothing really that we can do to modify the progression of symptoms if somebody were to get COVID. It just has to run its natural course. And the goal and the focus is to just make sure you keep the patient comfortable. And in cases of kids, thankfully, they don't have the same complications as adults do, because in adults, we do have to kind of look out for more things to make sure that they don't need some type of respiratory support if their oxygen levels are getting low. But for your kids, you know, they're very, very resilient. If they've been vaccinated, they're even going to be more resilient. And so, you know, just kind of keep an eye on them, do what you would normally do, and test in 3 to 5 days just to see whether or not they were actually exposed and infected, or just exposed.
Thank you. And a question about if you're vaccinated and you test positive, and this was a staff question, do you use your personal leave? Right now, that would not be the case because the district is continuing to extend wellness leave to employees who are fully vaccinated if they test positive or if they're identified as high-risk exposure and they have some symptoms. So that's what we're currently offering for employees who are fully vaccinated. Okay, I think those are all of the questions right now, but Dr. Gonzalez, is there anything else that you'd like to say or share before we start to wrap up with some information about academics?
Sure. I think the only thing, you know, one thing is to stress that I know that all of the questions and answers can tend to get a little bit confusing, and often it seems like we're, you know, repeating ourselves, or maybe even saying the opposite. Everything is a case-by-case basis, so there's not one size fits all. So, you know, encourage anybody who has any questions to reach out to your primary care doctors and have them help you figure it out. And the CDC has excellent resources available to help answer some of these questions. But more importantly, I'd like to leave everyone with the message that if you are eligible to be vaccinated and have not yet been vaccinated, I highly encourage you to go get vaccinated as soon as possible. And there's plenty of locations throughout the city, and there's plenty of vaccine available. So I encourage anybody who has not yet been vaccinated that can be vaccinated to go out and vaccinate themselves and their kids.
Well, I want to thank you again, Dr. Gonzalez, for being here. And we have a few other things that we're going to cover, and you're welcome to continue to stay tuned. But thank you so much for sharing your expertise and for sharing your time. We really appreciate it.
You are welcome. Thank you so much for having me.
Thank you.
We're so fortunate to have medical experts who are willing to give their time to us to answer our questions. And we thank Dr. Gonzalez for being such a strong partner with SAISD. The last section that we'd like to cover is an academic update. Many of you, oh, nope, Tony, I think you're going to cover.
Let me just talk briefly about this wonderful back to school resource fair that's scheduled for this Saturday. And parents, I anticipate that you've already received information about this, but if you haven't, we want to make sure that you know that this is happening on Saturday. All kinds of opportunities for students to get shots, vaccines, even for families and students to go through COVID, to get COVID testing, you know, on site, but there will be free backpacks, other kinds of supplies, uniforms available, and other things. We want students to be there to have fun, but we also want you to be able to take advantage of some of these wonderful resources. And in addition to that, we have an English and Spanish version. We have posted a series of vaccine clinics that we're sponsoring between Saturday. We have 10 between Saturday and Friday, August 6th. For all of these high schools that are identified and listed here, those will serve their feeder campuses with eligible students. So any students that are 12 and older can attend one of the clinics in the feeder patterns. We're going to send information out to parents and make it available online so that you'll know how to register your child, but also how to get registered yourself or to register, you know, family members. Bringing it, you know, into the community and as close to you as we can to make it as easy for you as possible to take advantage of it.
Okay, so we'll go now to the academic updates. Many of you attended Jumpstart. It was very exciting. We offered this early program at 95 of our schools. We had almost 9,000 students participating daily in STEM activities, art, dual credit, and attending field trips. And this was very important to us because we know that to help our students get on track from what for some was fragmented year of being in person and being remote, we were able to offer them high quality and high impact curriculum, engaging, exciting to get them ready for school. So you're probably asking, what are we going to do to help your child get adjusted to returning to school? Many of the students who may have stayed remote all year long. We want to assure you that one of our highest priorities is continuing to build strong relationships. We have mentioned several times about our commitment to supporting students' social and emotional well-being. All of our teachers on August the 3rd will be engaged in professional development that will help them support students in the classroom and identify students who need help. We have probably the most certified youth mental health first aid presenters, and our secondary teachers will be engaging in that. It's considered some of the best support for educators to help students in the classroom. Our elementary teachers will be participating in trauma-sensitive schools and creating healing spaces in the classroom. Of course, we've had a consistent focus on culturally responsive and sustaining practices and ensuring that learning is engaging and relevant for students. So that social and emotional safety is extremely important to us. It's one of our core strategies to mitigate what many are calling learning loss due to COVID. Another is rigorous on-grade level instruction. I know that in the media, you may have heard a significant amount of focus on intervention. What we know and what the research is supporting and what we are planning is that our emphasis really needs to be in on-grade level core quality instruction, especially in reading and math. We know from the research that you just can't offer tutoring enough to make up for losing quality instructional time. So we are focusing on that, providing exemplary resources, and ensuring that we maintain a high expectation on college and post-secondary readiness. We also will use multiple strategies to determine where your children are at, which include what teachers are doing daily in the classroom, the kinds of teacher-made assessments that give them quality information about student progress. We also will continue to conduct formative assessments. Many of you are aware of our NWEA map that we use to help know where our students stand in relation to one another, in relation to schools within our district, and in relation to national norms. We'll be adjusting our instruction in real time and individualizing it for students. But most importantly, we'll approach this work with an asset-based mind frame. Again, it can be very scary in the media hearing all of the information about how much our children have lost, but we believe that our children have also learned a lot during this pandemic. And while it probably wasn't specifics around mathematics instruction, we know that our students are learning and developing as humans and individuals. And so our goal is to believe in the wisdom and genius of our children and to provide them with the best instruction possible, to understand where they might have gaps and to mitigate for those gaps in an individualized way. We'll also be providing supportive, targeted, and flexible recovery, which could occur during the school day in whole group and small group after school. We'll also continue to provide our 24/7 online tutoring through tutor.com that students can access through ClassLink. And we will host another intersession in January 3rd through 7th. I know that it can be difficult to know as a parent how to help your child, and I would encourage you to reach out to your child's teacher to ask for updates or to ask for guidance on how you can help at home. All of our teachers will be conducting parent conferences, so please mark your calendars for September 27th through October 9th. That coincides with the end of the first marking period, and so we'll open up the window for parent conferences early and we'll extend it late. On the agenda for teachers will be reviewing student progress with you so you'll know how your child is doing, reviewing their grades, discussing the kind of assessment data that's being used to determine how your child is doing, and then also what might need to be done in an individualized way for your child so that they can stay on track. We'll continue to post up-to-date information on our parent and student webpage. You've submitted many questions this evening. We've tried to answer as many as we could. We do have an FAQ that is posted currently with questions that we knew you would ask in advance. We will go back and update this FAQ with questions from tonight so that you can have those as well, and we'll repost that. But on this webpage, you can also find information about school supplies, uniforms. There'll be a link there where you can click on and see uniforms by individual campus. You can also register if you're not already for Frontline Parent Portal and browse around so that you can get some information. That's where you can find lots of information about your student and their progress. And then of course, we'll be posting parent workshops. We heard from many of you how much you appreciate those. You can find out how to navigate Canvas, which we'll continue to use, how to navigate ClassLink, how to support your child who might need additional math support or reading support at home. And we'll also continue to have parent workshops on other topics. I'd like to answer some questions that we have that have come in that I think I can answer. One of the questions is about whether we're going to allow volunteers on campus this year, and the answer is in light of the increasing positivity rate, we definitely want to be cautious. So we are going to highly recommend that anyone on campus wears a face mask. That includes our parents. We do want parents to know that parents, you are welcome at school to deal with school business. For example, if you need to speak to someone in the office or if you need to have a parent conference. When it comes to volunteers, we're going to limit that to those adults who've been vaccinated because volunteers on campus is discretionary. And we believe that our parents are counting on us to keep the school as safe as possible. And typically a volunteer represents someone who is on the campus for a prolonged period of time. So we're going to ask that they be vaccinated. Another question is, I have concerns about my child falling behind. What if I'm worried and I want to know what's going to happen to help support my child in after-school tutoring or in the classroom? I recommend that you talk with your child's teacher so that you can ask those specific questions. If you are concerned that your child perhaps lost a lot of ground during COVID and you're worried that your child might need to be retained, we recommend that you reach out to the counselor at your school. We do have a provision for parents to request a retention. I will say though, in my experience, that retention is not a good, it is not a recommendation I would make for most children. But I would encourage you to talk with your child's counselor and the principal at the school. That information will be included in the FAQ that is posted online. There's also a question about if your child is in school and your child needs to be quarantined, will your child still have access to schoolwork, or will that learning be cut off for the 10 days that they're at home? And the answer is that we will keep our digital systems up so that if a child is quarantined, they can always access their work through Canvas or through ClassLink. We will not be offering online synchronous lessons. Our commitment was that we need to ensure that we have very strong instruction in the classroom, and we're going to not ask our teachers to do in-person and remote because it was extremely challenging for them. But we will keep our digital systems available and active. So Canvas and ClassLink will be available, in all the applications that normally children would have access to in ClassLink will also be available. The other thing is, if my child is quarantined, will that affect their grade? Will they get a 0 for all of the days that they're absent? And the answer to that is no, because that would be an excused absence. So we would want them to work with their teacher to make that work up. We also have several questions about attendance. As of this recording of the town hall, we do not have any information from the Texas Education Agency specifically around how we will handle attendance issues for students who have to be quarantined. Right now, the guidance is that they would be counted absent, but we're continuing to work with the state. We're continuing to advocate for us to have some flexibilities around that so that we can ensure our students stay on track and that are not penalized. But again, we'll be waiting for the Texas Education Agency to release more information on that. Okay, with that, I think that concludes. Oh, there's one more that's a question regarding the medical provisions for homebound services. That is also in the FAQ. There's a link that explains what qualifies as a medically approved condition. And there is information there where you can contact someone who can get you into the process for an evaluation for that. And with that, this concludes our town hall this evening. We hope you found the information helpful. If you have any additional questions, please do not hesitate to reach out. You can find our contact information on the parent and student webpage, along with constituent services telephone number, and we encourage you to reach out if you have questions. Thank you so much and have a good evening.